Hello and welcome to my channel. I am Dr. Sandeep Madan and today we are going to discuss one of the very important clinical condition which is called as subclavian steal syndrome. Now to discuss about the syndrome, let us first see the normal vascular arrangement and then we will come to the obstruction point. So here what we can see that we have been given certain vessels. Let us label these vessels and this one is arch of aorta, this one is arch of aorta, and we all know that arch of aorta will give this branch which is left subclavian artery, and this branch which is left common carotid artery, and on this side, on the right side, we have brachiocephalic trunk. Now the name is brachio and cephalic, that means it will give one element for the brachium, that means for the upper limb part, because brachium means arm, and one component for the cephalic region. For the cephalic region, this artery will be given which is right sided common carotid artery, and for the brachium this branch will be given which is right sided subclavian artery. So these are the vessels which will be taking origin from this arch of aorta. And from the subclavian artery, we have one vertebral artery on this side, right side, and one vertebral artery on this side, that is left side. And both these vertebral arteries will merge together to make basilar artery. And eventually, basilar artery is ultimate going to make the circle of Willis. It is going to participate in the formation of circle of Willis. So the circle of Willis is for the cerebral circulation. So in a nutshell, we can say that basilar artery is going to take the blood for the cerebrum, for the brain. Okay, and this will be the blood flow. On this side, the blood is going this way. The blood is going this way, and from this side the blood is going this way, like this, like this, like this, and then these two blood streams will merge, these two blood stream will merge. So eventually the basilar artery is taking the blood to the brain. This is present in all the individuals like this is the arrangement. Now consider one condition where there is a blockade, some kind of obstruction is here. Now, because of the obstruction, the blood which was supposed to go from this side, from the arch of aorta to subclavian, it can't go. If it can't go from this side, so there will be no blood here in this segment. The blood is not there. So for time being, we can consider just hypothetically the vessel will become empty or the pressure will be zero. But the blood is going from this side. I'm just showing this with the arrow outside, but obviously blood is traveling within the blood vessel and it is going in this direction. From this vertebral artery, some blood will keep on going in the basilar artery, just like previous flow towards the cerebrum. But some blood from here will start coming in this direction, and via this vertebral artery, it will start filling in the subclavian side. That means now the subclavian is again receiving the blood, not from the arch of aorta, but from the other sided subclavian, then vertebral, and the same sided vertebral. This is how the blood will be reaching over here. But the subclavian is using the blood which was meant for cerebrum, as if subclavian is stealing the blood. That is why it is called as subclavian steal syndrome. That is why it is called as subclavian steal syndrome. And now this patient comes to you, and you, as a surgeon, you know what is the situation over here, and you ask the patient to go for Doppler ultrasound, and in the Doppler ultrasound you can see the blood flow direction, and normally the blood flow should be from the vertebral artery towards the basilar side, so that for the cerebral blood flow. But in this patient there will be reversal of the blood flow from the basilar artery. The blood is coming towards the vertebral artery. That is how the subclavian artery is receiving the blood. Now, obviously, when the subclavian artery was receiving directly from the arch of aorta, the blood pressure was high. Now the blood pressure will be very low comparatively if compared to with the normal condition, and the pulse will be also weak. And when the upper limb is used, then there will be more demand for the blood, and the more demand means more cut off the blood from the cerebral circulation. The neural features will aggravate. So if you take this question now, read the question carefully, and let us discuss what is the syndrome here and what should be the correct answer. So the features given over here are all the neural features. Okay, headache, vertigo, ataxia, and all these neural features, they are initiated by the using left arm for the daily activities. Okay, radial pulse on the left side is weak. Left BP, systolic BP is reduced by 30 mm of Hg. Okay, and Doppler ultrasound reveals reversal of the blood flow in the left vertebral artery. All the given point, they will tell the diagnosis, that is subclavian steal syndrome. And now where will be the blockade? It has to be critical stenosis of the first part of subclavian artery. It has to be the proximal, because if by chance, let me show you the diagram, if by chance obstruction is here distal, then they will not be able to take the blood, right? So it has to be proximal obstruction only. So that was all, dear friends, for today's discussion. And keep on watching this content. If you like it, please like, comment, and subscribe. Thank you.